Very good evening, everyone. It again gives me immense pleasure to be back here along with all of you. I think we've been talking a lot about diabetes and other complications. We've been talking about the microvascular complications, we've been talking about the macrovascular complications. One important thing, I think, which the females, especially, face, diabetic females, all of them, I would say, even a non diabetic females face this issue of perimenopause. So this is a phase generally which starts around 40 years. To some female, it starts very early, from 30s as well. So that is a time where a lot of physical, emotional, mental changes keep on happening, where it is very important to be aware of it, and then it is very important that you meet a consultant and try to improve your symptoms on that. So today, to talk more on that, the diabetes, the perimenopausal symptoms, around everything, we have three beautiful ladies with us who are going to take us through this journey. So let me welcome Dr. Vidhya Jahagirdar. She is the consultant endocrinologist at KMCH Coimbatore. She has interest in metabolic bone disease, women's health. She's done a lot of education and training in UK. Very good evening, ma'am.
A very good evening to you all.
Thank you. Next, we have Dr. Alpana Sowani. She's a consultant diabetologist at Diabetes Specialty Center, Mumbai. She has won an iconic Women Leaders Award, so we are fortunate to have her as well. A very good evening, ma'am.
Good evening. Good evening to all of you.
And then we also have my friend, my colleague, Dr. Nanditha Arun. She's a consultant diabetologist, director at Dr. A. Ramchandran Diabetes Hospital. We all know her from Chennai. And then she has received the Young Investigators Award from our own RSSDI Society last year in 2021. Very good evening.
Hi, good evening.
Yeah.
Happy to be here.
Yeah, thank you. So to start with, Nandita, my first question to you would be, what is the perimenopausal period, and why do the women gain weight, particularly during that period, and how do you take it from there? Over to you.
Sure. Thank you, Faraz. And like I said, this is, the very special program that we have this evening where we discuss a topic that is not so commonly discussed, isn't it? We always talk about lifestyle changes, we talk about lifestyle diseases, we talk about cardiovascular risk, but we quite often tend to neglect, or this is a topic that is not so often discussed in the medical forum, or even discussed openly among women itself. So it's quite apt that this evening we're discussing this. Now your question was, what is the perimenopausal stage? Well, as the name indicates, peri means anything around, and we all know menopause is the stage where the periods or the menstrual cycles of women tend to stop. The normal physiological halting of the menstrual cycles. So this period can usually start, just like you mentioned, Dr. Faraz. It can start anywhere around, starting from the age of 40 to 45, or sometimes even earlier. It is, in medical terms, we can even call it the sort of transition phase, which is sort of from the transition from the reproductive stage to the menopausal stage. So it's that in between stage where you're not there yet, you're not attaining menopause, you have not attained menopause yet, and yet you're still not completely in your prime of your reproductive years. So this in between transition, where you transition from the reproductive to the menopausal stage, can last from months or even up to years. And why is this important, and why are we discussing this today, is only because this can be, like I said, because it is a transition phase, this can be sometimes a little difficult for women. There are certain peculiarities, certain characteristic features, and problems that women face at this point. One of the questions that you asked me, the second part of your question, was why do women also gain weight? That is one of the effects that women do experience at this point. There's many reasons for this. Women at this phase have changes in their hormonal levels, most important. there is a drop in the estrogen levels, and many other hormones, which of course I don't want to go into the details of, but that hormonal imbalance itself can cause a little bit of change in their metabolism, their metabolic rate. So as a result, they do start feeling lethargic. They start developing other symptoms like hot flushes, mild mental mood swings, depression. All this can in turn also cause eating imbalances, and the lethargy and the lack of interest in physical activity and working out or their routine exercise, all these sleep disturbances, all these factors put together can contribute to weight gain. And this weight gain, what is important about it is that it's not just an overall weight gain, but there could also be a change in the pattern of the weight gain, in the sense there can be an accumulation of fat more in the abdominal area, which is what is the abdominal obesity, or an increase in waist circumference, which is an important risk factor, or a cardiovascular risk factor among patients with type 2 diabetes. So with that as an introduction, I will next ask the question. We have Dr. Vidhya and Dr. Alpana with us here today. Dr. Vidhya, the next question goes out to you. How common is it to develop diabetes and hypertension during this period, especially in women in the perimenopausal stage?
Okay. So what we do understand is that because of the change in the distribution of the fat, as you have already mentioned, there is increase in insulin resistance in these patients. And as a result, the blood sugars, there's going to be hyperglycemia to some extent. And in patients with already who have already got diabetes, the glycemic control can worsen. Now, is this going to happen within the first year of menopause? It's not entirely true. It can happen in the perimenopausal period. It can happen a few years. It can start happening a few years before the patient has actually attained menopause. And this risk of developing diabetes and hypertension can continue over the subsequent years, and the risk of developing diabetes, hypertension, and subsequently increase in cardiovascular disease is higher as the woman ages, especially when she gets to her 60s, is when her actual risk increases. And this risk is high in patients who have had a family history of who have got a family history of hypertension, and patients who had hypertension during pregnancy. So the risk of developing diabetes and hypertension is a continuum in the perimenopausal period, but the risk goes up higher as the woman ages, especially when she gets to her 60s. So the next question would be to Dr. Alpana. So it's also known that in a woman with diabetes, as I mentioned, there is loss of good diabetes control. So if that is true, is it true? And what can be done to maintain good glycemic control during the perimenopausal period?
So thank you, Vidya, for that question. And as you have already laid the foreground for this question, I'd like to be, yes, definitely diabetes does worsen in the perimenopausal period. There are multiple reasons, as Nanditha mentioned. It's basically the estrogen levels start falling, which leads to an increase in insulin resistance. So the glycemia does, a patient who is having diabetes does develop some amount of dysglycemia. But what is the reason for this, and what can we do to prevent this? I think it's not only the insulin resistance, it's not only the central obesity. We know we are a carb-rich eating, population. So any which ways we are centrally heavy, we are high incidence of diabetes. But what is important during the perimenopausal phases, that because of all the symptoms coming in, whether it is the hot flushes, the night sweats, the increased incidence of UTIs, the irritability, the mood swings, all of these lead to a decrease in self-care by the patient. The irritation which is continuously there with the patient, and they don't know how to deal with it. So what do we do about this? That is the million-dollar question. So first and foremost is, I think we need to normalize the perimenopausal period. We need to tell them that this is a temporary condition. It is a part, just the way menarche happened. The first time they got their period, there were fluctuations in their daily routines. Now this is the second half of your life, and we need to normalize it. It should not be treated like a disease or a problem. So we need to tell them, chill, it's temporary, it's going to go away. Just deal with it. How do we deal with it? I guess once they are symptomatically better, we will take better care. So first is take care of your diet, make sure that you're eating healthy. Don't stress eat, don't have an increase in carbs, eat clean, don't have fried food, get their mood in a better way. And I think that is going to help with counseling. Also, another thing, things which worsen their symptoms, like spicy foods are going to worsen the hot flushes, so let them stay away from spicy food. Any sweet or any deep fried food, not only with bad glucose control, it is also going to make their night sweats worse when their sugars are high. So we need to make them understand that. But I think most important point is exercise. The lethargy that they feel because of the in the perimenopausal phase, it is very important that they exercise. And it could be any form of exercise with which they are comfortable and how much they can deal with. And they also need to be counseled that to make sure that when you are exercising, the initial few days might be a little difficult, but once you start doing it on a regular basis, you are definitely going to feel better. I think that is something which is going to go a long way in controlling their sugars as well as making them better. Another common problem that we see is sleeplessness. Patients are not sleeping. So advise them about what is good sleep hygiene. That will help with managing sugars as well as the leptin granule values. When they come into order, their blood glucose control will be better. So I think I will take the next question to Nanditha. What kind of diet and exercise do you think these women should follow during the perimenopausal period, Nanditha?
Right. I think you've partly discussed that, Dr. Alpana. So I completely agree with what you were saying, that we need to normalize this phase of life. That's absolutely, I agree with that. And like I said, earlier, like I started off the session, I was saying that we talk about lifestyle quite commonly, but we do not talk about the life cycle that women go through, and especially for women, there are different phases of life, and it's normal physiology. We need to sort of make women understand that. So why I'm starting off with this is because of course it's important to maintain a good lifestyle and a good physical activity and watch your diet, but not just at this phase, it's at every phase of your life. It shouldn't be women during the menopausal or the perimenopausal phase should not be victimized, or should not be sort of felt that, shouldn't start feeling like a sick person and tell them that this is the time you should start exercising, or this is the time you should start. You should be watching your diet, exercising, and maintaining a good lifestyle all through at every stage of your life. And of course a little extra care and to be taken during this phase if necessary. But because of the little changes that take place, and of course the sleep hygiene, all that goes without saying. Now, what would be the best diet? There is no such thing as a best diet. It is just about eating healthy, eating clean, and including a lot of green leafy vegetables, avoiding fried foods, avoiding salty foods. I think the salt content is something we probably could stress on, because the salt can increase water retention, and a lot of bloating is something that can worsen the symptoms. So reduce the salt in the diet. Sugar, of course, goes without saying. Refined sugars to be avoided. And these are the basic principles around which to work. But at the same time, I think we should also be sensitive to women at this stage, and like I said, not enforce this upon them and expect them to turn everything upside down, because then they're going to, like I said, they're going to feel like they're victims or like a sick person, and they can't possibly change everything overnight. So take it one step at a time and try to eat as healthy and as clean as possible. Include, like I said, green leafy vegetables, fruits as much as possible, nuts in your diet, avoid processed foods. These would be the basic guidelines. As far as physical activity or exercise is concerned, it has to be individualized. It's about what suits the person. what fits into their routine, daily routine that they have, because we shouldn't be imposing something that cannot be followed and where adherence becomes an issue. So whatever a woman or a lady at that stage enjoys, if it's a sport, then so be it. That will probably be the best thing, because playing a sport is something that can help in every other way. So not just with the physical activity, but even with tackling stress and so many other benefits that you get. If it is going for a walk, then so be it. If you enjoy doing yoga, go ahead and do that. But what I think we need to stress on is, whichever form of exercise it is, number one, make sure it's something that you can sustain, and you can adhere to, and you can keep doing. Women are in general, when we look at, especially in the Indian scenario, they're generally dependent. So if someone is very enthusiastic and goes and enrolls herself in the gym, and then she has to depend on someone to take her to the gym, that's not going to be practically possible. So do something that fits into your routine, do something that you can adhere to. And if it is going to be yoga, walking, swimming, jogging, running, whatever suits you. The important point also to stress on over here would be, if women can also include some muscle strengthening exercises, like training of their muscles to improve their muscle strength. That would also go a long way, because at this stage in their life, there is a certain amount of laxity, and then the muscle mass can start to reduce, and there's an increased risk of osteoporosis, bone abnormalities. I'm sure Dr. Vidya can add to that. So if you could include some muscle strengthening, that would also go a long way. But like I said, nothing specific. There's no one rule fits all. I think the next question goes out to Dr. Vidya here. So, Dr. Vidya, are there any specific supplements that you think women at this stage need to take?
Okay, so when we start thinking about supplements, we should be assessing what exactly is deficient and what is needed to help them. So, most patients complain of hot flashes. That is one symptom that they, not able to tolerate, and that can cause mood swings, lack of sleep, and they find it very, very troublesome to cope with these hot flashes. So, there are several supplements available in the market, such as the phytoestrogens, evening primrose oil, black cohosh, but this is not routinely recommended by the doctors, because the evidence or the benefit of these supplements is not been proven. On the contrary, if there are any risk factors for breast cancer, or the patient has already had breast cancer, then these can pose to be causing a more harm to the patient rather than of any benefit. So I don't usually prescribe any of these supplements, but if the patient does suffer from hot flashes or mood swings or any other vasomotor symptoms, then perhaps they should consult their endocrinologist or their gynecologist for a menopausal hormone replacement therapy, which would be of more benefit to them rather these supplements such as phytoestrogens and the evening primrose oil. Another supplement we should start thinking about is calcium and vitamin D. Not everyone would need. What we can do is assess these patients for how good their diet is. If they're taking adequate calcium in their diet, then they perhaps don't need a calcium supplementation. We'll have to assess if their sun exposure is good. Um, if not, we'll have to check their vitamin D levels and supplement vitamin D, which is important for their bone health. Because if they are calcium and vitamin D deficient, then they are at high risk of developing osteoporosis. If not immediately, in the next few years to come, they are at high risk of developing osteoporosis. And this is one supplement I truly believe, if we find that their vitamin D levels are low, then we should definitely replace it adequately. And for that, they'll have to see their physician or gynecologist or endocrinologist to have this supplement done at an adequate level, and not just take some kind of a calcium vitamin D preparation that's available in the market.
Sure. Thank you,
Okay.
Dr. Vidya.
Yeah. So the next question again is to back to you, Dr. Nandita. What can be done to prevent diabetes if it is common in women in this stage?
Right. So, it is known earlier, it was thought earlier that diabetes is more prevalent among men and women are not as affected as much. But recent data, prevalence data that we have recently conducted is actually shown that there is, in fact, an increase in the incidence of not just diabetes, but also pre-diabetes among not just men, but equally so among women. And what is important to note is that another belief, another myth that with not exactly a myth, another fact that is actually changing now is that we used to think that diabetes is more a disease of the affluent, or that diabetes is affecting more of the urban population. But recent data now has shown us that it is increasing not only in the urban, not just in Chennai or in the cities, but also equally in the rural and in the semi-rural areas. So this is a very important factor, because we're talking about women who are probably not as much educated, women who are again dependent on their spouses or dependent on whoever to take them to for access to medical care, women who in whom the awareness rates are probably not as much. So this is an alarming point, and we do need to address it. Now, as I mentioned, there's an increase in the prevalence of not just diabetes, but also pre-diabetes. And why this is important is because when we talk about pre-diabetes, this is the borderline stage, or the stage, or the so-called ticking time bomb, because these are people who are waiting to convert to diabetes. And once you do convert to diabetes, your cardiovascular risk, as we all know, doubles. So if we can actually capture these women at that particular stage, in the pre-diabetic stage, and prevent that progression, then there's nothing like it, because we are reducing their cardiovascular risk that much. So we have conducted, of course, studies. We have a number of prevention studies which have been conducted, and the Indian Diabetes Prevention Program is one such study in which we have found that the best, of course, many strategies, including pharmacological agents, have also been studied for their role, or to find out which is the best tool to prevent type 2 diabetes, or to delay the progression of type 2 diabetes. And what we found is that the best strategy is lifestyle modification. So simple changes in the lifestyle, like adopting to a healthy diet, reducing your saturated fats, increasing the fruits and vegetables, increasing your fiber, increasing the protein content, and physical activity. Simple, just walking, brisk walking, 30 minutes a day. That's what the subjects in our study actually did. 30 minutes of brisk walking a day, 5 days a week. This actually resulted in a significant 30% reduction in the progression or the incidence of type 2 diabetes in people with pre-diabetes. So I think the take-home message from this should be that yes, it is possible to reduce the risk of progression to type 2 diabetes, and yes, it is common among women as well. And we do need to sensitize women, and patient and awareness among women about the importance. We cannot stress enough about the importance of lifestyle modification, about the importance of physical activity and healthy lifestyle. The next question I think would be to Dr. Alpana. So, Dr. Alpana, should women with diabetes consider any tests that can be done to know their risk of different conditions, and how often should they be repeated?
So thank you, Nanditha. Definitely. See, perimenopause or menopause, it's anyways coming in the second half of their lives. Ideally, in the today's scenario, I think anyone post 40 should be checking themselves up for all the NCDs, the non-communicable diseases. So I think perimenopause would ideally be the perfect time for women. We know that in our country, women are not paying enough attention to their health. So I think we can use this as a good time to get a basic workup done for them. because of the insulin resistance, because of all the hormonal changes happening. We've already discussed this, that they're at an increased risk of things like diabetes and hypertension, heart disease. So I think a basic checkup of their health, where we look at what their fasting blood glucose, postprandial needs, probably an HbA1c, a lipid profile, some basic cardiac assessments, like, probably be an ECG. I think I'll be going beyond wishful thinking if I start talking about a 2D echo or a stress test. I don't think that is required. But at least a basic cardiac checkup, where they at least reach a PHC or a doctor, someone who will check up, and whatever is needed to be done at the second level can be done. But this is the basic minimum. Dr. Vidya also talked about supplementations being required, and as she very clearly said, it's not necessary that everyone requires to be on calcium supplements. So I think doing a calcium and vitamin D level is also a sensible thing. We are seeing that with the estrogen levels dropping, we need to have a lookout on our bone health as well. So probably a DEXA scan is something which should be recommended to people who can afford it. Probably their first mammo, a pap smear, these are the tests which they should do. I think this is a good time where most women should try and reach their doctors, reach out and at least get this workup done. If all is good, very nice. If it's not, then we can start treatment. The earlier we start, we know that we can prevent complications in the long term. So I think these are at least annually these tests should be done, but a basic lipid profile, fasting, post lunch, and a ECG should be done at least annually. So going to the next question, um, this is to Dr. Vidya. Is stress an important contributor to diabetes, and what can be done to combat it, especially in this phase of their life?
Okay, so it's a very, very important question, um, because we are looking at the average age of menopause in India. And in Indian women, it's around 46 when compared to the Caucasians, where they attain menopause a bit later. So around 46 is when actually women are the peak of their career. They'll have to balance their work and family, and probably got children still settling in their job or going to college. And here this lady is going through menopause, and that itself can cause a lot of anxiety, because she might have some information on lack of estrogen and what it could do to her heart or her bones. And the lack of estrogen itself can cause mood swings. So there's a lot of things that can attribute to poor glycemic control. And we know that when one is stressed, the cortisol and the adrenaline, the counter regulatory hormones, go up. And when one is stressed, this can cause poor sleep at night. And we often find that in patients with diabetes, they can have a elevated fasting blood glucose and an elevated HbA1c as a result of stress itself. So we'll have to try and find the triggers for stress. Is it something that is modifiable, or is it something that the patient can cope with? If not, we'll have to help them with some strategies to cope with that stress. If the trigger cannot be removed, then we'll have to teach her some coping strategies. And like Dr. Nanditha has said, exercise is one very good way of alleviating stress against very balanced eating habits. We'll have to incorporate good behavioral changes. So we could recommend meditation, yoga, swimming, even walking or jogging is really good, not just for their mood, not just to alleviate the stress, but good for their bones too. So balanced eating, um, and healthy lifestyle, again, quitting if they are smokers or drink too much alcohol, this could all contribute. So they'll have to look into their lifestyle, try and balance work and family, look after themselves. That's the most important part. Is they're not very concerned about their mental health. They just work, and over a period of time, they just lose themselves in work and looking after their children or husband or in-laws, and do not focus enough on their physical or mental well-being. So when I see patients in my outpatients and try and find out if they're stressed and perhaps they need to see a psychiatrist, or even suggest an alternative a treatment like cognitive behavioral therapy, there's a bit of a resistance from the patient in accepting the fact that she is stressed, and that could be the reason for poor sleep or worsening glycemic control. So there's still a lot of stigma in India in accepting that a patient is stressed or depressed or very anxious. We should just make them understand is mind is as important as their body, and we need to treat them both equally.
Thank you, Dr. Vidya. Dr. Arun Kedia has a comment about sarcopenia and how it may be associated with perimenopause causing decreased activity. Can we get a quick comment on that from you, Dr. Alpana, Dr. Vidya? Can we just a brief mention about that, please?
So, as Dr. Kedia has very correctly put it, that yes, sarcopenia is definitely associated in the perimenopausal period. And I guess all the factors that we've been discussing over here, the bad mental health and the bad physical health, and along with that, the introduction of all our lifestyle and the NCD diseases, they can definitely lead to sarcopenia. Or probably I would like to go on to add that when by the time the women are reaching their late 40s, they're anyways having a decreased activity level. I think in India, women are just associated with fertility, and the minute we start thinking about menopause, you're like, okay, the woman's work is done. And I think a lot of the rural women actually picture themselves like that, so they stop taking care and they're lethargic. Probably in our urban areas, we are thinking of our 40s as like, okay, we are at a good place in our life, but in rural India, that's not true. So they just tend to take a backseat, and that worsens their sarcopenia. So definitely a very good point, Dr. Kedia. There is association of sarcopenia with perimenopause, and I think good eating and good exercise can help them improve their situation.
Thank you.
Very, very true. I think we should start encouraging our patients to be active throughout their life, not just in the perimenopausal phase when already the sarcopenia has set in. I think we should basically encourage our patients, every patient who comes into our outpatient, be a 20-year-old type 1 or a 40-year-old lady with very well controlled diabetes, we should encourage them to be active and actually prep them for the peri or the postmenopausal phase, both mentally and physically. We should prep them so that they are ready to face these hormonal changes that's a natural process and inevitable in women. So basically, preparing them for the menopausal phase is very, very important, and that's something we should focus on in our clinical practice.
Absolutely. Thank you. Thank you, Dr. Vidya. I think the last, we've discussed quite extensively almost every aspect about perimenopause. We started from what it is about to what diet and physical activity, how important it is to, right up to what supplements to take, what not to take, what to do, what not to do, and how to handle stress as well. The last part, I think, and we'll talk about this, and then we can probably conclude with a small brief summary of what we've discussed. Dr. Alpana, I think you can probably take the first part of this question. Do all women with diabetes develop heart disease in the perimenopausal stage?
So no, definitely that's a hard no. It's not necessary that all perimenopausal women get heart disease. Definitely not. And I hope that all the people out there listening to us start enforcing these things. The only thing that I would tell the listeners is that make sure that the take-home message from here is it's not necessary that just because you're in the perimenopausal age, you're going to get heart disease. But it's yes, as we reiterated earlier, please check for this, because this is a phase where we can start noticing them. The earlier we catch it, the better we can treat it. So please don't. To all the listeners, this is definitely not a go-to that if you're developing perimenopause, you're going to get heart disease. No, for sure not. Take care of yourselves, and we can beat it for sure.
Yes,
Your
absolutely.
opinion, Dr. Vidya?
I think the risk factors would be
Yeah.
a strong family history of cardiovascular disease, premature heart disease in the family, smoking, physical inactivity, obesity, and of course comorbid conditions like high cholesterol or uncontrolled cholesterol, blood pressure, and of course the presence of diabetes. All these would increase your risk factors, risk of heart disease. But having said that, no, like Dr. Alpana said, not all women will develop heart disease, but these would be the risk factors that would increase your risk. And beyond that, I think what you need to keep in mind is that heart disease is preventable. And if detected early, there is good treatment available for it to prevent a heart attack or a cardiac event. So if you have any of these complications, and why is this pertinent or relevant in the perimenopausal period, is because with women, our estrogen, like we all mentioned in the initial part of this session, estrogen level starts to come down, and the hormone estrogen has a protective effect against heart diseases, and this protection is actually lost in the postmenopausal phase. So which is why we stress so much on the importance of cardiovascular disease in this particular phase of life. But yes, it is absolutely something that we can prevent and screen for, and if detected early, you can definitely prevent a cardiovascular event.
Yeah,
We have
I
Dr. Purvi.
completely agree with Dr. Nanditha and Dr. Alpana. We'll have to, yes, look out for risk factors and start screening these patients. But also, there are two other groups of women who are slightly higher risk of cardiovascular disease. Women who have got polycystic ovarian syndrome, people and patients who have had gestational diabetes. These again are two groups of women where the risk could be slightly higher. So we should elicit the history and start screening these patients in their perimenopausal period.
I think with that, we've covered most of the points here. And I would like to thank RSSDI for this opportunity. And it was great talking with Vidya and Nanditha. I hope we've got our message across to people.
So there's one last comment that if one of our experts uh, can comment on whether omega-3 can be used as a preventive measure in this perimenopausal period.
Okay, so I think I covered the supplement part of the question, and I didn't mention about omega-3 because there is no good evidence to suggest omega-3 is going to prevent cardiovascular disease. It's used by cardiologists in very, very few selective patients, but not in the context of preventing cardiovascular disease. I'm aware that omega-3 is available as an over-the-counter pill, and it's not going to cause a lot of harm, except that you'll be wasting your money if you're thinking that it's going to prevent you from getting cardiovascular disease, because there is no real evidence proof that it is going to prevent cardiovascular disease.
So any final message from all three of you, Dr. Nanditha, Dr. Vidya, and Dr. Alpana?
So I think the
So
take-home
I
message.
yeah.
Sorry, Vidya, go ahead. Vidya, go ahead.
So my message would be not be stressed about menopause. It's going to happen to all of us at some point in our life. I would say all the ladies out there, stay positive, be active. You'll have to be selfish at point and look after your mental and physical health. We are much, much stronger than we actually think we are. So we'll have to just keep going, look after our health, and all that we discussed so far, like looking after ourselves, healthy balanced diet, exercise. Just fit in any exercise that you can do on a daily basis, and a diet that you can sustain, and just keep a positive attitude. And I know that's all I wanted to tell to all the ladies who have been listening to us today.
So I think the closing statement would be this: let's just normalize menopause. It's just a normal phase of all the women are out there. And I think we've discussed in quite a good extent that exercise and taking care of our meals is the way to go.
Absolutely.
Nandita?
I think Dr. Alpana and Dr. Vidya have covered. I can't really add much more to that. But yes, I think normalizing it and not feeling bad or guilty and to come out and speak about it. I think, or not feel ashamed. I think that's something that we need to shout out. If you have difficulties, if you're having any disturbances with your sleep or whatever it is, and understand that it is a normal physiological process that every woman will go through at some point. All our grandmas and our great grandmas and our great aunts have gone through. It's just little nuances that we need to sort of get past, and it makes us stronger and much more beautiful at the end of it.
Such lovely messages today, and I'm really thankful to each of you for having tackled so many different questions that are commonly asked to each of us, during this perimenopausal period. And I must thank you, because at such short notice you all have stepped in and made it so simple, and I think wonderful messages given to our audience today on handling or going through this perimenopause. We do tend to make a big deal about it, but I think the entire idea is to just educate our women more that it's all natural, it's physiological, and with a little help, with a little guidance and a little mindfulness, you can get through it in a very comfortable manner. So I thank Dr. Nanditha Arun, Dr. Vidhya Jahagirdar, and Dr. Alpana Sowani from the RSSDI core team, our president, Dr. Brij Makar sir, our secretary, Dr. Sanjay Agarwal sir, the entire executive committee, and of course, thank you from Dr. Faraz Farishta and myself from the social media team as well. So thank you very much for being there, and this episode is recorded. It will also be shared it will be posted on the RSSDI website, and I urge all of you to look, view it again. It's also on YouTube, the official RSSDI channel. Please view it again, go through it, see what you have read first time, watch it again so that you just get the gist of what our experts are saying. Thank you once again so much.
Thank you so much.
Thank you.